many of you use lullabies to fall asleep at night? I know I did. Every single night. It had to be in there in the CD player. What about running or exercising? How many of you exercise with music? It's such an important part of our lives every day. Now transition that to your patients, the ones you've seen on clinical, the ones you're going to see in the future. Think about how music helps you and how it can help them later on. So, in January 2011, we remember that Congresswoman Gabby Giffords for Arizona was shot while she was in Tucson during an assassination attempt. She was shot in the left side of her head, and fortunately for her, she was able to survive her extensive injuries. She went to the Institute of Rehab and Research Memorial in Houston, Texas. There she had OT, PT, and speech to help her regain all of the issues that she had from her traumatic brain injury. One of the ways that her speech therapist helped her was using music to regain her speech, and this video kind of demonstrates how they did that.
Rebuilding speech after an injury to the left side of the brain is exhausting, often agonizing work. Before the shooting, she was a dynamic, engaging speaker.
The libertarians and the vegetarians.
A Fulbright scholar, fluent in Spanish.
Good morning, everyone. Buenos dias.
Now, in those early therapy sessions in Houston,
You turn on the light.
it seemed as though words had abandoned her.
Let's try this one. Watch me. Just turn on the...
For those of us injured on the left side of the brain, our loss of words can make us feel trapped inside our own minds.
Gabby, are you frustrated? Can I tell you something? It is going to get better. Okay? It's frustrating right now, but it is going to get better. You've come a long way in 5 weeks. You've come a long way.
And then, in this emotionally charged moment, to our absolute amazement, we heard this.
Okay? You're going to do this. You ready? This little light of mine, I'm going to let it shine.
Remember, at this point, she couldn't say the word light. Suddenly, there she was, singing that word and a whole lot more.
I'm gonna let it shine, let it shine, let it shine, let it shine.
So more recently in the news and in the Journal of American Academy of Pediatrics, they published a study in 2013 dealing with infants in the NICU, the Neonatal Intensive Care Unit. They saw that these premature babies benefited from gentle music such as lullabies. It helped increase or decrease their heart rate, helped them feed and sleep better, increased weight gain, and also just in general speed up their recovery time and have them go home from the hospital sooner to be with their families. So in a way, music was actually their medicine. It was something that helped the babies heal.
Music and art change our perception of the world by evoking an emotional response which then inspires an action. They draw you into a world that distracts you from your everyday worries and distresses. The rhythm and repetition of music are appealing because they promote that harmony and self-reflection. Music and art help us to express our unconscious desires through alternative mediums. And a lot of people make fun of the performing arts because they think it's just a bunch of people who spontaneously burst into music and dance, which is sometimes true, but for the most part it's all very intentional and done for a good reason. I once had an amazing drama teacher who told us, he described a character's progression of self-expression, and he said, if you can't speak it, sing it. And if you can't sing, then dance. And I think this is very important for patients and people just like Gabby Giffords who have trouble with that verbal communication and they know they can't rely on it. Music is that powerful connection between the mind and the body, and it's really a way of finding our subconscious desires and then figuring out a way to express those desires to another person. And it really drives that communication and the cohesion that we strive for. In many ways, music is both personal and universal. Two people can listen to the same concerto and draw a different conclusion from it. And so from this, it really facilitates discussion between people, between cultures. Music and rhythmic activities can be seen across all cultures and age groups. Some examples are Buddhist chants, drum circles, you could even say dubstep is one. Music is truly a powerful tool, and it accomplishes what we hope to do as physical therapists. Our interventions aim to access multiple dimensions of a person, including their self-actualization, their culture, their personality, the same way that music does. And it's really a versatile medium that connects the mind, the body, and the spirit. And I really believe that as the medical community, we can transform our field by implementing some of the principles that exist in music and art.
According to a recent systematic review that was published in the World Journal of Psychiatry, music therapy and musical interventions were proven to have beneficial effects on mood and psychological well-being. It's essentially a side effect-free intervention to promote functional recovery and reduced psychological disturbances and behavioral disturbances in patients. So, we found that it was effective for reducing anxiety, effective for reducing depression, and it had a significant effect in a patient's feeling of communication, interpersonal skills, self-confidence, and overall quality of life. So these are all huge elements in our plan of care as physical therapists. We know that on a daily basis we'll encounter patients that are battling depression or anxiety. We see a lot of patients with chronic conditions, let alone all their personal factors. If they had a traumatic injury, they're coming out of a big surgery. We see this a lot, and our ultimate goal is going to be to increase that trusting interpersonal relationship between the two of us. So we want to make sure and promote that communication, and then as a quality of life, that's always our optimal goal in patients. So music therapy can be explained on behalf of neurological, psychological, and rehabilitative explanations. On the behalf of rehab, music is found to improve function in the motor area of the brain. So basically what they found is that this effect is connected to pleasure. So this is really great news for us, because if patients can connect physical therapy to like a good emotion, maybe they'll want to come more and they'll want to participate more, they'll be more engaged, they want to take more part in their plan of care. We can put a new spin on different exercises, and by doing that we'll have their favorite song will be a little bit of weight shifting to the rhythm of their favorite song, or maybe we'll use the tempo of a new song to help them like walk across the room. It's really an easy additive to all of our interventions, and it has the potential for so many benefits, and it's relatively risk-free.
So we already know that there is an abundance of evidence in the neurological field that physical activity can not only prevent the normal degenerative changes that happen with age, but it can also help to prevent some of the abnormal ones, such as in the cases of dementia, Alzheimer's, and Parkinson's disease. There is also evidence that music, this evidence is not so abundant as it is with physical activity, whether it be playing an instrument, writing music, or simply listening to music, can have the same effects that resist those changes that can cause memory loss, motor dysfunction, and mood disorders. Both physical activity and music together not only can prevent, but also can rehabilitate the brain after these neurodegenerative changes have happened. And what better way to combine both but to dance? A recent study in the journal Frontiers in Psychology has said that this is a good alternative to neurorehabilitation therapies. Dancing improves motor function and skill while also using the cognitive functions such as perception, memory, and executive functioning, as well as affecting our emotions. The benefits of using both together greatly outweighs the use of using just one or the other. Why might this be the case? The answer is that it has the same effects on the brain in different ways, which can increase the neurogenesis effects. Music activates many parts of the brain due to its emotional and cognitive persuasions, while dance requires the individual to plan movement, remember steps, and be in rhythm with the environment, such as their dance partner and the music. Dancing also enables the person to make social connections while doing the activity that is enjoyable to them. This can help improve mood disorders, and the use of dance can enable the patient to feel that they are in control of their disease and disability and make them happier. Instead of being a subject of their rehab, the patient can become a participant in their rehab. So the next time your favorite song comes on the radio, I want you to think about how it makes you feel, and then think that this can have the same effect on our patients and make our connections with them stronger.